Hello and welcome to our continuing discussion of schizophrenia and affective disorders. This is going to be our last unit talking about anxiety disorders. So anxiety disorders are psychological disorders caused or characterized by tension, overactivity of the autonomic nervous system, expectation of an impending disaster, and continuous vigilance for danger. So sort of a heightened state where you're tense, you're expecting something to happen, and you have activation of your autonomic nervous system, so you're physically feeling that anxiety. Anxiety can take a lot of different forms. This is kind of a vague definition to accommodate the myriad of different anxiety type disorders that do exist. Just a few examples of the more common anxiety disorders include panic disorder. This is marked by episodic periods of symptoms, which are things like shortness of breath, irregular heartbeat, and other autonomic systems. In fact, people who've never had a panic attack or a panic disorder episode often mistake the panic attack for a heart attack or something like that. They are very physically real and very upsetting. Generalized anxiety disorder is excessive anxiety and worry that's serious enough to disrupt your day-to-day life. So we all have anxiety about everything, right? Like there's lots of things to worry about, and that's normal. Feeling anxious is normal, especially if you have like a big talk coming up or your big exam. There's lots of things that can make you feel anxious. Generalized anxiety disorder is excessive anxiety and worry that disrupts your day-to-day life. That's so bad and so unrelenting and from seemingly every source that it disrupts your day-to-day life, right? So it's crossed over into disorder at that point. Social anxiety disorder is an excessive fear of being exposed to the scrutiny of other people that leads to the avoidance of social situations. So being terrified of what other people are thinking of you or what might happen in a social situation is a social anxiety disorder. Let's talk a little bit about prevalence. Anxiety disorders are more common in females. Twin and family studies suggest that there is indeed a strong hereditary component. One theory is that variation in the gene that produces BDNF, or brain-derived neurotrophic factor, is at least partially responsible for this hereditary component. This particular item right here, BDNF, is important for neural survival and differentiation during development, and plays well in a role rather in LTP and memory. So it's a pretty wide functioning thing that does a lot of stuff, so it's a good candidate. fMRI studies, unsurprisingly, show increased activation in amygdala and insular cortex for those who suffer from anxiety disorders. Over here, we have a graph depicting people aged 15 to 25 and 35 to 44, and the percent of them that express panic disorder. You can see both in young and early middle adulthood, females are more likely to present with an anxiety disorder than are men. So how do we treat these disorders? Well, one is benzo class drugs. These treat the acute symptoms of anxiety disorders. These have a very rapid onset, making them great for emergency use. They work well as the amygdala contains a high concentration of GABA A receptors. If you remember from our earlier discussions of psychopharmacology, benzo class drugs work on GABA A receptors. They are indirect agonists, or what we would call positive allosteric modulators. They increase the conductance of chloride through that channel, so they improve the functionality of GABA A receptors. They potentiate them when GABA is present. As effective as they are for short-term use, they are not the first-line approach for long-term treatment. They can cause sedation, intolerance is induced pretty rapidly to benzo use, and withdrawal symptoms can be very unpleasant. So they're not the first choice oftentimes. SSRIs, we talked about these in the context of treating depressive disorders, but they can also be used for anxiety. This is a commonly used treatment for the long-term maintenance of anxiety disorders. You can see here we have fluvoxamine, which is an SSRI, compared to placebo in people suffering from panic attacks. We can see that over the course of weeks, those who are on the SSRI show decreased panic attacks relative to the placebo control group. Okay, let's talk briefly about obsessive-compulsive disorder. Obsessive-compulsive disorder, or OCD, is a mental disorder characterized by obsessions and compulsions, right? Hence the name. An obsession is an unwanted thought or idea with which a person is preoccupied. And a compulsion is a feeling that one is obliged to form that behavior even if you prefer not to do it. So an obsession might be like wondering if your door is locked or wondering if the stove is on. A compulsion would be feeling like you must go and check those things. Right? Even if you'd rather not do it, you feel like a compulsion that you should go and do that. And there's a bit of a learning and memory angle here, right? So your obsessions are anxiety-provoking and unpleasant. right? So if you're worried that the door is not locked, you worry about that. That feels bad. Your compulsion will provide a source of negative reinforcement, right? You can go and check that door and it removes the worry, right? So you feel good. You're more likely to go and do that again, right? So every time you give into a compulsion and go and check that door, it strengthens the behavior, right? You temporarily relieve the anxiety from your obsession. So it's a cycle like that. There is some evidence of a genetic origin, right? A greater concordance rate in monozygotic twins than dizygotic twins. We talk about this a lot. So the more genetic material you have in common with someone with this disorder, the more likely you are to have it yourself, right? There is a evidence for heritability here. Though sometimes there are sporadic cases, especially following brain. Oh, this over here is like a little circle-based pointillism type drawing of John Green, who is a famous author and YouTube guy who suffers from OCD and has been pretty public about it. Okay, so what are some possible treatments that we can use? Well, cognitive behavioral therapy. This works on that learning aspect that I mentioned earlier, right? If one of the reasons that this behavior is becoming strengthened is because of the reinforcement of you checking or giving into the compulsion every time you feel that obsession, cognitive behavioral therapy, a therapist can sort of help you puzzle through that, help you figure out what's doing what, and give you a sort of a behavioral plan to follow to curb your giving into those compulsions and to try to alleviate anxiety in that way. This can be on its own or in combination with pharmacological therapy. SSRIs have also proven useful for people with OCD. So fMRI studies show increased frontal lobe and caudate nucleus activity. Sometimes this disorder is treated with a cingulotomy, or a surgical destruction of the cingulum bundle. This is what connects the prefrontal cortex with the limbic system, or at least one way that those two are connected. It's not the only connection, but it is one connection. This helps reduce intense anxiety and other OCD symptoms. Of course, this is going to be to someone who's really, really suffering, and other approaches just aren't working, so it's a pretty extreme measure. Not something you hear of happening very often. Okay, that concludes our discussion of schizophrenia and affective disorders. See you